The search intensifies for an Austin man who escaped Sunday night from a state mental hospital. Alexander Irvin had been there since a jury acquitted him in 2014 of his father's murder by reason of insanity. He was seen climbing over an 8-foot fence at the North Texas State Hospital in Vernon before running off. As KXAN's Tahira Rahman reports, law enforcement is adding more manpower amid concerns he could turn violent.
A multi-agency search continues for Alexander Irvin, the man who escaped from North Texas State Hospital in Vernon on Sunday night.
Everybody has expressed concerns if he's not receiving his medications that he becomes more violent, and that is an extreme concern for us here in Vernon.
Vernon Police Chief Randy Agan says their partners include the Texas Rangers, DPS, and the U.S. Marshal's Office. They've searched dozens of buildings in and around Vernon.
We have utilized aircraft trying to search dense areas with technology and radar systems to determine if someone could be hiding inside of dense areas along the river.
Agan couldn't comment on how Irvin may have escaped the state hospital, but new data shows their struggle to hire staff. In a presentation to state lawmakers this week, Texas Health and Human Services said they've got more than 1,000 unfilled positions at state hospitals. This chart shows the staff decline since 2020. A spokesperson tells us they've reduced the number of patients in Vernon to make sure they're meeting staffing standards. Agan says they will investigate how Irvin escaped, but first are focused on finding him.
And we have notified all neighboring agencies and agencies in Austin where Irvin is from, and they're conducting searches in their areas.
Tahira Rahman, KXAN News.
And the Texas Health and Human Services Commission says it's operating state hospitals at reduced capacity with more than 700 beds offline across the state. A spokesperson tells us if someone escapes, the agency immediately investigates, notifying law enforcement and the agency's investigating branch when appropriate. HHS says it also conducts a review to strengthen policies and procedures as needed.